The United States is at war, and it's not with a foreign nation, it's with the coronavirus. The nation's top infectious disease expert predicted yesterday that the number of cases and hospitalizations in the United States will get worse. From the rise of the Delta variant to breakthrough COVID infections, is every American doomed to get COVID 19? Experts weigh in. Coming up next.
Live from Los Angeles, this is the Special Report with Areva Martin.
Over the past 2 weeks, new coronavirus infections have risen by 148%, and hospitalizations have increased by 73%. The surge of infections has been largely attributed to the highly contagious Delta variant and to low vaccination rates in some states. Indeed, there are 100 million people in the United States who are eligible to get vaccinated but have not done so. Against this backdrop, companies from Disney to Walmart are mandating their employees to get vaccinated. Broadway is requiring proof of vaccination to see a play, and counties like Los Angeles have reinstituted mask mandates. While cities like Chicago, though, are hosting events like Lollapalooza, where over 100,000 mostly maskless people attended a concert for 4 days. All of this has our heads spinning, and all of us are asking, where does this lead us? We're going to talk about this with our guests and experts. My first guest this morning is Sylvester Crosby. He was initially hesitant to get vaccinated, but once his brother-in-law was hospitalized in the ICU with COVID, he and his wife decided to get vaccinated. Good morning and welcome, Sylvester.
Good morning, Areva. How are you?
I'm great. So there have been so many stories in the news about people who declined the vaccine early on until they got COVID themselves, or a family member became infected with the coronavirus. And a lot of these people, have expressed a lot of regrets about not getting vaccinated. So I want to ask you, you were amongst those people who early on had decided you weren't going to get the shot. Why did you make that decision?
For me, it was basically the science. I try to think with a certain rationale, and for myself, I felt like there wasn't enough science out on the vaccines. It seems like they fast-tracked it to make sure that we had something available. But again, the science, there just wasn't enough science out on the vaccines for me.
So I know more recently, your brother-in-law your brother-in-law and actually his wife both came down with COVID, but he had a really severe case and was in the ICU unit. Tell us about that.
Yes, I think he spent a total of 3 weeks just about in the hospital. Seeing what he went through, it was terrifying for me and the entire family. And it kind of made us change our mind almost immediately with regards to our feelings about the vaccines.
So I've had a chance to talk with your sister-in-law, Lori, and I know that Lori became like the family champion. She was like on a mission to get everyone vaccinated. How significant was Lori in your decision making?
You know what? I took her feelings and her thoughts towards it seriously. And again, after seeing what Michael went through and what the entire family went through, and actually having COVID in the house ourselves, our middle son caught COVID. It totally changed our it's just terrifying to say the least. And so
your middle son, how old is your middle son?
He's 16.
Oh, okay. So he's 16.
Yes.
Do you think, and I assume your 16-year-old had a pretty mild case, he wasn't hospitalized?
No, it's very mild.
So let's assume that the 16-year-old had gotten COVID, but Michael, hadn't had such a severe case that he had that, put him in the hospital for 3 weeks, do you think you would have still made the decision to get vaccinated?
You know what? I can't say one way or the other. I was at a standstill in my decision with regards to getting the vaccine. If he if he would have just terrifying. I'll go back to just terrifying.
It sounds like if Michael hadn't been as sick as he was, maybe you wouldn't have gotten there at this moment in time, right?
No, probably not.
Okay. And I know from talking to Lori, and I spent a lot of time back and forth with her on text message yesterday, that there still are a lot of members in your family and her family who still are deciding not to get the vaccine. Are you talking to those folks? Are you trying to encourage them now that you and your wife and Lori and she said her mom and some other members have been vaccinated?
Yes and no. There have been plenty of debates. My mother was one of the first ones in the family to go ahead and get vaccinated. So she was really instrumental in trying to tell everyone, hey, this is okay. It's something that we need. But we would like to make sure that we're all protected in a certain manner. And so we're encouraging everyone to get the vaccine. It's up for debate. You can't speak for everyone, but everyone has their own thoughts and their own feelings on it. My hope is that they would come to the conclusion that being vaccinated is best for them and their family.
Are you at the point, and some families are at the point where they just say, we don't talk about it because it causes too much tension, people get into arguments, or are you still able to broach the topic with family members and try to encourage them?
Honestly, we can't get past the point, there's some of us in the family that feel like COVID is, not real. And then there's some of us that have experienced it up close and personal. And so, we think that that they should go ahead and get vaccinated. They feel like they shouldn't. Very much up for debate in the family. We are just on our end. We're encouraging everyone to make sure that they at least take the thought of being vaccinated serious.
So where did you go to get your vaccination and how did you feel? Because we hear a lot of people saying, oh, I don't want to go because, I don't want to get sick. And, they have all these, fears of being sick afterwards. So, but what was it like for you?
I went to a local urgent care, which is actually just 2 or 3 minutes away from my house. Fairly easy process. I hate needles, so the shot was actually my response to the shot was, oh, you're done. I didn't have any side effects. They had me wait for 15 minutes after receiving the vaccination. I didn't feel any type of way immediately. I went to work that day. I felt fine at work all day. I stayed hydrated and everything went the way you would hope it would go. No adverse effects.
Great. I'm glad to hear that. I want to bring into the conversation now Dr. Paul Offit. He is the director of the Vaccine Education Center at the Children's Hospital of Philadelphia. He's also a member of the FDA Vaccine Advisory Panel. He's written multiple books, including Deadly Choices, How the Anti-Vaccine Movement Threatens Us All. I'm sorry, Dr. Offit. And he's also written Vaccinated, One Man's Quest to Defeat the World's Deadliest Disease. Dr. Offit is a friend of the show. He's been here many times to help us understand what's going on with COVID. Welcome back, Dr. Offit. I wanted you to listen to Sylvester because I wanted Sylvester to be able to ask you any lingering questions that he may have about the vaccine. But I also want you to respond to what he said about why he was initially hesitant. He said he wasn't sure about the science and it seemed like the vaccines were fast track. Can you help us understand how the vaccines got to where they are and kind of debunk this myth that's out there that somehow they were fast tracked and the science isn't solid behind them?
I certainly can understand the concern that the vaccine was developed quickly, because it was. The fastest vaccine ever made before this vaccine was the mumps vaccine, which took 4 years to make. This vaccine was made in 11 months. That virus was isolated in January of 2020. We had 2 large clinical trials of that vaccine by November of 2020. So, and the technology used to make that vaccine, so-called messenger RNA, was a novel technology. So I can understand the hesitancy initially, although people could have been reassured by the fact that the size of the trials, the 30,000 person trial of Moderna or the 44,000 person trial of Pfizer, was the typical size of any adult or pediatric vaccine trial. The length of safety follow-up, which is 2 months after the last dose, is the length that you would follow for safety for any vaccine trial, because all the serious side effects that have occurred ever in the last 200 years of vaccines have occurred within that first 2 months. The only difference between this and, say, a licensed product was the length of efficacy follow-up. So in other words, in December, when we said that those two vaccines were 95% effective, we could say they were 95% effective for a few months. We don't know whether they were 95% effective for 6 months, a year, or 2 years. So I can understand the initial hesitancy. And, Maurice Hilleman, who's the father of modern vaccines, he said it best. He said, "I never breathe a sigh of relief until the first 3 million doses are out there." So I can understand the initial hesitancy, but, more than 300 million doses are out there. I mean, this vaccine has been given to half of the American population. It's not exactly an experimental product at this point. It's safe, it's effective, and that this virus is a killer. It breaks my heart when I see people that are still hesitant to get this vaccine. I mean, I personally couldn't wait to get the vaccine. I'm on the FDA Vaccine Advisory Committee. I saw all the data behind this vaccine. I couldn't wait to get it, knowing that virus was out there.
So, Sylvester, here you are. You have one of the nation's leading vaccine experts. He's invented vaccines. He's written books about them. He advises the FDA. What lingering question do you have? You've gotten the vaccine, so you're there, but you still have family members. Maybe there's some information you can get from Dr. Offit that you can pass on to those family members that might help them get there. Like, what do you want to hear from Dr. Offit?
You know what, honestly, for me, the science is out there. It's just as simple as the rest of individuals around me taking the time to research itself. Some of the things that the doctor just said, I've read for myself. I took a lot of time to read in the 24 hours before I got the vaccination. I wanted to be secure in my decision and kind of steadfast in my thinking. That it's safe. So really, with regards to what he just said, that information is out there for everyone. Everyone needs to take it upon themselves to read that information, research that information, and make a decision for themselves.
Well, thank you, Sylvester, for being that kind of studious. We want informed consumers, right, Dr. Offit? We want people doing just that, reading the information and the science that's out there. Sylvester, before I let you go, just one last question I want to ask you, maybe Dr. Offit can address it. What are the reasons that your family members that are saying no, what are the reasons that they're giving you as to why they are not getting vaccinated?
Honestly, in short, I just don't think that they are taking this as serious as they should be. They believe that being studious and washing hands and being safe, practicing the guidelines that the CDC has set forth for us to combat this, they believe that suffice for them. My thing would be wait till you experience it up close and personal, till it kind of hits close to home. And that's definitely going to change their minds if, God forbids it hits close to home.
So, Dr. Offit, just real quickly, this is not for Sylvester because he's already there, but maybe you can help him give some information to those family members that think washing their hands, maybe wearing a mask, maybe social distancing is enough. Help those people understand why that's not enough.
Well, I mean, assuming you come in contact with other people during your day, you're at risk. I mean, the vaccine is spread by small droplets that emanate from the nose and mouth. If you're within 6 feet of somebody, you can catch it. I mean, if you look at just the last few days in this country, we've had case counts of 80,000, 90,000, and 100,000. We've had death counts in the high 300s, 400s, and 400s range. Those are the same numbers we saw last summer. Last summer, when we had a fully susceptible population, last summer when we didn't have a vaccine. I mean, why is it so bad this summer that looks like we haven't done anything? And the reason is the Delta variant. The Delta variant is much, much more contagious. If you look at the original strain that left China, the so-called D614G variant, and then you look at this Delta variant and just quantitate the amount of virus that emanates from the nose throat, it's 1,000 times more. That's number one. Number two is our behavior this summer is much different than last summer. We're much looser this summer than last summer. Just look at people that attend, weddings or birthday parties or games. Where now that everybody's all, gathered. That recent report, by the CDC of that outbreak in eastern Massachusetts. I mean, those were hundreds of people that got together for a July 4th celebration. It was a massive outbreak. So I think those things in combination have made for a tough year, and makes me think that as we head into winter, because this is at its heart a winter virus, this is going to be bad. People shouldn't have to experience this virus up close. I mean, my aunt died of COVID, a friend of mine at work, his father died of COVID. I mean, it's you shouldn't have to suffer this personally to believe it's real, unless you think that the 620,000 deaths that have been reported in this country are the media lying to you. I just can't. I don't understand that. I don't. It's a bad. Let me tell you one other thing. This is a bad virus. I mean, people, when this virus came out of China, and China billed it as a winter respiratory virus that, like influenza, can cause severe and fatal pneumonia, this virus is much worse than that. This virus causes you to make an immune response to the lining of your own blood vessels. It causes inflammation of the blood vessels, otherwise known as vasculitis. And we see that in our hospital. And I work in a children's hospital all the time with these kids that come in with multi-system inflammatory disease, which also happens in adults, where they get involved in not only their lungs, but their heart, liver, kidneys. And they have these long-term effects are all based on that vasculitis. This is not a virus you want to get, because you may be living it with far longer than you thought, assuming you live with it.
Yeah. Thank you for that response, Dr. Offit, and thank you, Sylvester, for joining me this morning. Thank you for taking the plunge, for being a role model for your family, for getting the shot, and you have some more information now in your arsenal. So when you are having those debates, if you choose to do so, and I know sometimes it can be difficult and contentious, but when you do, you can let folks know you've talked to one of the leading infectious disease epidemiologists, vaccine specialists in the United States, and you got it from him, directly from him. Nothing you read, nothing you heard, but you talked directly to Dr. Paul Offit, and hopefully that'll help change some minds and move some people in the right directions. Thanks again so much for joining me this morning. All right,
thank you for having me.
Absolutely. I got to ask you a couple of questions, Dr. Offit. You talked about how widespread this is, and the fact that COVID is primarily a winter respiratory virus, and we heard it, from the top public doctors yesterday that we're going to see this virus get worse. Do you think the CDC made a mistake when they told vaccinated people that they could unmask indoors?
Yeah.
Is that too premature?
Yes, I think it was. I think what they did, it was it was at best naive. I think what they thought was that we're going to give a gift to people who are vaccinated by saying they can now unmask even indoors, assuming wrongly that would mean that when you were at the supermarket indoors, that everybody who was masked was unvaccinated, everybody who was unmasked was vaccinated. That's a lot to assume. First of all, it assumes everybody listens to the CDC or even knows the CDC exists. So I think that was not fair. I mean, when I walked into a supermarket, I mean, I'm obviously vaccinated and have been since January, but when I walk into a supermarket, I wear a mask because I don't trust people that are unmasked that they've all been vaccinated. I mean, if I'm at the hospital and I'm sitting in a room with fellows and residents and I know that they're all vaccinated, I'll take off my mask, even indoors, because I know they're all vaccinated. And if you're asymptomatic, meaning you have no symptoms and you're vaccinated and you're around all people who are vaccinated, the chance that you're going to spread that virus is about zero. So that's good. But I just don't trust in public that most people are vaccinated. Nowadays, certainly nobody's paying attention to the CDC, but I went to the market the other day. Nobody was wearing a mask. So I think people aren't listening. I think you're right. I think people are getting tired of just this. It's sad. See, to me, when you said, for example, there's a war going on out there, when you introduced the show that way, what's interesting to me is that, I mean, as a child of the 1950s, there was a war against polio. I mean, polio would paralyze 30,000 children a year. It would kill 1,500. The virus was the villain. The virus was the bad guy. The virus was who you fought this war against. The virus had no friends. Okay, that's not true here. SARS-CoV-2 virus has many friends. It does. I mean, it has, conspiracy theorists or science denialists or vaccine denialists or purveyors of misinformation on cable television or on on the internet, to social media. Those are all friends of the virus. These governors that stand up and say that they're prohibiting mask mandates or prohibiting vaccine mandates, I would like to see a little cartoon character of SARS-CoV-2 come up and shake their hands and say, thank you for letting me to continue to spread, because those are friends of COVID-19.
As a vaccinated person, would you recommend that vaccinated people even go into events and, venues where there are unvaccinated people who are unmasked? So if like Sylvester said, with certain parts of his family won't get vaccinated. So if that family is having a function and those unvaccinated people are also unmasked, is it wise for him or anyone that's vaccinated to even go into those settings?
No, in general, but I would say that it depends on what's going on in the community. If you live in a highly vaccinated community and you have, say, fewer than 100 cases per 100,000 in that community, you're generally pretty protected by the herd. But if you're living in a community, and that's pretty much true of all communities right now in the United States, because this country now is on fire with this virus. If you're living in a community where the virus has continued to spread and you're with unvaccinated people, remember, no vaccine is 100% effective, and so you ask a lot of the vaccine that if you're around unvaccinated people who may be spreading that virus either asymptomatically or mildly symptomatically, wear a mask. I wear a mask indoors now, period. And I'm going to continue to wear a mask indoors until things really settle down.
But Dr. Offit, is that a part of the problem? The news media and the experts come on and they say, if you live in an area where this is happening or that's happening, you should wear a mask. That's a lot for some. Nobody's waking up in the morning trying to figure out, am I in an area that is with high transmission and go vaccinate? That's just, that's one thing that we've not added to our daily routine. So why isn't the guidance just wherever you are, no matter who you are, do X? That's a simple rule that people can decide to follow and most will follow. But when you start with all these if this, then that, isn't that a part of the confusion that people are so sick of?
Yes, I completely agree with you. And that's why I think that the answer here is that if you're indoors, wear a mask until this thing settles down. Instead of trying to go to your local health department and figure out how many people per 100,000 are transmitting this virus, I completely agree with you. The simpler, the better. And the more complicated you make it, the more people are just going to say the hell with it and do whatever they want.
And, we've heard Dr. Fauci yesterday say lockdowns aren't going to happen. He says, we're not going to go to that, but we are seeing these mandates. Do you think that is the direction? Biden is kind of dragging his feet, in my opinion, about these mandates. And I don't know if he's trying to signal to big companies that they should jump out and do it first and give cover for the federal government. It's kind of all over the place. So Walmart now and Disney says mandates, but we haven't heard it from Target and some of the other big box stores. So again, the mandates are all over the place. Do you think we just need to say as a country, everybody get vaccinated, and if you don't, then don't come to work, don't come to a grocery store, suffer some consequences?
I completely agree. And I think that's going to be the conversation over the next 6 months to a year. We have about 95 million people who aren't vaccinated. At least 2/3 of them are refusing to be vaccinated. And what do you do? What do you do when basically a significant percentage of the population says, I don't care. If the virus continues to spread, if it continues to mutate, continues to create variants that are more and more resistant to vaccine, I don't care. And then what do? You can stand back and say, okay, it's your right as an American citizen to catch and transmit a potentially fatal infection, which it's not, or you can mandate the vaccine, which is what's happening. I mean, the Penn healthcare system mandates vaccines. Our hospital, Children's Hospital of Philadelphia, just mandated the vaccine. And these are hard mandates, meaning if you're not going to get the vaccine, then you can't work there. And I think you're starting to see that more and more in the private sector. The Biden administration has talked about mandating the vaccine for federal workers, but they have a pop-off, which is that, if you choose not to get a vaccine, then you can get weekly testing, which is not the same thing as getting a vaccine. If you're going to be a federal employee paid by the government, I think that you should get the vaccine. You're a member of society. Also, remember, many people can't get vaccinated. Certainly people less than 12 can't be vaccinated. There's at least 500,000 people out there who are on cancer chemotherapy or biological agents for their chronic diseases that can't be effectively vaccinated. They depend on those around them to protect them. Do you have a responsibility as a member of society to not transmit this virus? You do. And I think it's an extraordinarily selfish act when people say it's a personal choice when it's not a personal choice. It's a choice you make for other people.
Yeah, and I often, as a lawyer, have to remind people that there's so many ways that the government regulates our behavior, from no smoking laws to seatbelt laws, to you can't drink or buy liquor until you're 21. So it's not as if this vaccine is the first time that the government has regulated our conduct. That's the way we live in a civilized society. And we've saved millions of lives with smoking bans, saying you literally cannot smoke on airplanes, in stores, and buildings. So this isn't, a new concept that for the greater good and for the health of the greater good, we take actions to regulate conduct. Quickly, I want to ask you about schools. Schools are going to open. And again, the CDC has been kind of all over the place about masks in schools. Certain districts are saying, as you said, certain states are saying no mask mandates. Kids under 12 can't get vaccinated. They're going to go into schools, old buildings, poor ventilation. What's going to happen to these poor kids, and when will they be allowed to get vaccinated?
I think in a better world, and we don't live in that world, anyone over 12 who's going to school should be required to get vaccinated, much as we have school mandates for other vaccines. And similarly, if I was the father of a 10-year-old and I can't get my child vaccinated because there's not a vaccine available yet, and will not be until late, until early next year, or at least in the middle of winter. I would prefer to believe that my school had a mask mandate. I mean, I certainly would send my child to school with a mask on, and I would prefer that there be a mask mandate because I think that puts my child in a safer position. There's going to start to be more than 1,000 deaths a day once we hit winter, and the children are always the ones who suffer our ignorance, and that's what this is to me. I mean, when people just have blanket statements about no mask mandates, no vaccine mandates, I think you don't know. So why don't you just take the safer course, right? I'll give you a perfect example. One of the states that has the lowest vaccine rates is Mississippi. The last time I looked, they were in the low 30% rate. The answer to the question, what state in the union has the highest rate of vaccines for children? Mississippi. They're up around 99%. Why? Because they're one of only 2 states a few years ago that only had medical exemptions to vaccination. They didn't have philosophical or religious exemptions for school entry. So if you went to public school in Mississippi, you had to get vaccinated. So they had, this is not a state necessarily known for its public health achievements, but had 99% immunization rates among children. So which is to say people can be compelled to do the right thing.
Wow. Quickly, Dr. Offit, prediction in the next 30 days. Biden is rolling out this army of influencers, TikTok, Instagram, to try to encourage particularly younger people to get vaccinated. We know vaccinations in many places have plateaued. Any predictions in the next 30 days?
I think it's really hard. I think that the current culture is that there is a certain group of people who are not going to get vaccinated, and I just don't think you can accept that. And I think what you're going to see is more and more at the level of private industry asking people to get vaccinated. You can't go into a bar unless you're vaccinated. You can't go into a restaurant unless you're vaccinated. I think you're going to start to see that more and more. I'd feel better about that. I'd feel better about going into a restaurant where I know I had to show my vaccine card. And I think that people don't like that because they think as an American, it's your right to do what you want, which is fine. I mean, if I step on a rusty nail and go to the doctor's office and they offer me a tetanus vaccine and I say no and I get tetanus, that's a personal decision because no one's going to test tetanus for me. Right. It's not a contagious disease. That's not true. You read these stories about, man decides not to get vaccinated. He gets COVID-19. He then transmits that virus to his pregnant wife, who then, because she's pregnant, is increased risk, goes to the hospital, goes to the ICU, gets ventilated, delivers her baby prematurely and sometimes fatally. He made a decision for himself, his wife, and his child. These aren't personal decisions.
No, that's such a great analogy in terms of how your personal choice when it involves your health is so different than making a choice that can infect other people, including people you love. Just the last question for you. You've written a lot about anti-vaxxers. What do you think is the one leading motivation behind the folks who are pushing out misinformation and really creating this environment where people are just saying no to vaccines?
I think they like the chaos, frankly. I think some of them are true believers. They believe that their child got a vaccine, and because of that, they say had autism. I see the book right behind you, which study after study has shown is not true. But once you scare people, it's hard to unscare them. It's hard to unring the bell, and this is their moment. They're very good at it. They're successful at scaring the hell out of people, and it's too bad because we need this vaccine to get out of this mess.
Yeah. I like what you said. They like chaos. Great answer. Thank you so much, Dr. Offit. Always a pleasure to see you. You have to come back because this obviously COVID isn't going anywhere anytime soon. And as we move into these winter months, really scary what's ahead of us. But always great to have someone like you with your expertise and your willingness to share it with our audience. Really appreciate you.
Happy to come back. Take care.
Okay. All right. My next guest is Dr. Jeffrey Klosner. He's an epidemiologist. He's an infectious disease specialist. He teaches at USC Keck School of Medicine in Los Angeles. He's an advisor to the CDC, the World Health Organization, and the National Institute of Health. So welcome to the show, Dr. Klausner. Thank you so much for joining us this morning. So many questions about what's going on with this Delta variant and how it impacts all of us. And I know you spend a lot of time working for the CDC and other federal agencies, advising them. Help us understand why we're not seeing the emergency authorizations for the COVID-19 vaccines move to that stage of being permanent authorizations. You know, a lot of people are pointing to that, saying, look, I don't trust this vaccine or these vaccines because they're still under this emergency authorization provision.
Well, I think the first thing we have to recognize is that, most people, the majority of people actually, do trust the vaccines. 95% of doctors have been vaccinated, and a lot of, nurses and other healthcare professionals have been vaccinated. All doctors recommend their patients get vaccinated. So the vaccine is safe. It's very effective. In terms of the time it takes to go from FDA authorization to FDA approval, that is indeed a long process. So medications and vaccines and other kinds of interventions, devices that go through the FDA approval process sometimes can take 5 years or longer. We do know now that the FDA is on a full court press. They have brought on additional staff, and the reality is they go through every single line of data, line by line. They're looking for errors, they're looking for typos, they're looking for mistakes, and they really want to be 100% certain when they finally give the approval that the data support the evidence that they use to give that final approval for marketing and licensing.
Well, based on everything you've said, this, full court press, bringing on additional staff, do you anticipate we're going to get that final authorization by the end of August? I've heard some experts suggest that it's imminent, but that sounds like that's, probably overly optimistic given the process you just described.
Well, I think it is really hard to know. I mean, we heard a couple months ago to expect this approval in September. We're not aware of any real hiccups or any real concerns that have been expressed by the FDA. So the manufacturers generally, inform other experts if they need more data or they need more science. We're not aware of the FDA coming back with any additional requests. So I think we are on track for an end of August, September approval. We know that, those the highest level, including, the White House, have exerted a lot of pressure to make sure that, the approval is going as quickly as it can. But, no one wants to, have too much pressure and make sure, that it's done correctly and according to law.
The other issue, Dr. Klausner, that we see in the news a great deal is this debate over boosters. Do we all need boosters? It looks like there's this battle between the private company Pfizer and the CDC and some of the nation's top, infectious disease doctors who seemingly are saying, wait a minute, not really clear that boosters are needed. But Pfizer seems to be pretty aggressive in their push that at least some portion of the population do need booster shots at this point. Help us understand, what the science is around boosters.
Right. So what a booster typically is an additional shot of the same vaccine. So for some infectious diseases like hepatitis B, it requires 3 shots. So there's the first shot, which primes the immune system. There's a second shot, which is often considered a booster. And then there's a third shot or a final booster. So the current vaccine schedule for the 2 mRNA vaccines have 2 shots. So there's the initial prime shot and the second shot of the booster. So people are concerned, particularly in the elderly or particularly in people who are immune compromised, people who take certain kind of immune suppressive medications for things like psoriasis or arthritis, or in people who have been organ, transplant recipients, such as kidney transplant recipients, that they may not respond as well as otherwise healthy people. And it's typical in those individuals individuals that doctors give them an additional shot, usually six or 12 months later, and that's what we call a booster. Right now in Israel, they recommended that people 60 years or older do get a third shot or a booster vaccination. I think we're still waiting on the data in terms of what is scientifically, evidence or best practice. It was only in early July, now that there's an FDA authorized antibody test, which can actually measure the accurate amount of antibody in someone's blood. And by using that test, we may be able to determine who needs a booster and who doesn't need a booster. But that test was only very recently made available and is only now being studied to determine the benefits of boosters.
Should we all be seeking out this antibody test to determine, what our level of antibodies are? Because some of us, like myself, I got my first shot, my first vaccine, really early in January. So I was done with the vaccine process by the end of January. So, some reports suggest that, by 6 months later, now we're into August, that your immune system may not be working in the same way that it was working, say, in February or March, right after getting the vaccination.
Well, you have to remember that our immune system is very complex. So we have antibodies, which are circulating in the blood or at the mucosal surfaces in the nose and the mouth. We have B cells, which are the antibody-producing factories that are also circulating and ready if they see an invader or the virus to ramp up production in 24 to 48 hours. We also have T cells, which is another arm of the immune system, which are cells that communicate with other cells and then further help launch the attack against an invading virus. And now there's evidence that up to 10 months, after infection or after vaccination, these other arms of the immune system, the B cells and the T cells, are primed and ready. So currently, there's no recommendation that people get an antibody test to see if there's still circulating amount of antibodies. But if someone, is in one of these categories that they're immune suppressed, they take immune suppressing medications, perhaps if they're elderly, they should talk to their doctor and see if, they may be at increased risk. Fortunately, at least in the current data that we've looked at, through this weekend, there's no association between when you got your vaccination and if you're increased risk for breakthrough. So the evidence so far tells us that the vaccines are working. The vaccines work very well to prevent people from getting severe disease, which is really what you want the vaccine to do, right? You want the vaccine to prevent you from getting sick, from going to the hospital, from going to the ICU, from having to be ventilated, from dying. And that's what the vaccines really do work.
And, one of I think the biggest news over the last week or 10 days or so, Dr. Klausner, has been this notion now, breakthrough infections. Many of us believed early on that if we were vaccinated, that we were immune to actually getting the virus. And now we're seeing these breakthrough infections. This town in Massachusetts, fully vaccinated people accounted for 74% of infections in this one town. And, that has a lot of folks really freaked out, like, what's going on? We thought we were safe with the vaccine, and now we're seeing, these breakthrough infections. Help us understand why that's happening, particularly with this Delta variant.
Right. So we always knew that breakthrough infections were possible. Even in the early studies, the vaccines were only 85% effective at preventing any kind of infection. They were 97 to 100% effective at preventing hospitalization and death, but they never were 100% effective at preventing infection. Now, this Provincetown outbreak, what they really haven't shared in the general media is this was a very large party of gay men known as bears, typically, who come together for this week every year, and the weather was terrible. It was raining. So you have a lot of men coming together, going inside very crowded bars, no masks, no social distancing, because of the rain, very poor ventilation. And this is the ideal setting for intense transmission. So while there were thousands of people at this event, there were, or they estimate, tens of thousands thousands of people at the event. There were 1,000 infections, and among those 1,000 infections, yes, 70% were vaccinated, and 7 people ended up in the hospital, but no one that severely impacted, and no one died. So the vaccines did what they were supposed to do in terms of preventing, most people from getting super sick, hospitalized, or dying. But correct, they did not, fully prevent the breakthrough infection, and that's why we always recommend these layers of protection, right? So people need to be vaccinated. They need to avoid crowded indoor spaces. They should try to be outdoors if they can. If they can't be outdoors, now the CDC is recommending that everyone, wears a mask indoor crowded settings.
Do you think the doctor at the CDC made a mistake when they came out and suggested that, or not suggested, but basically issued a guidance that said fully vaccinated people didn't have to mask up when they were indoors? And now, you listen to a lot of the experts that are opining about this on various, news stations, and they're saying the CDC was premature, that they should have never changed the mask mandate, that we should have always had, as you just called, these layers of protection: vaccination, mask, social distancing, outdoors as much as possible.
Well, we know that the vaccines are highly effective at preventing people from getting sick, hospitalized, or dying. So, vaccinated people really do not need that extra layer of masking unless they're in, certain, high transmission, crowded settings. I think what the CDC did not expect was that, if they liberated, people vaccinated from having to wear masks, that everyone else would drop their masks as well. And, there really were no recommendations that businesses or venues or other settings, check people's vaccination status. So in Europe, they have a Green Pass program where you can't go to an event, you can't go to a restaurant unless you have documentation of vaccination. And then that can easily separate people who do have to wear a mask because they're unvaccinated versus those who don't wear a mask. But in the United States, most places never took that approach, and there were no CDC recommendations to do that. So I think had we approached it with a little different strategy, we could have still, maintained vaccinated people, no need to wear a mask, unvaccinated people wear a mask. But because of human behavior, particularly in the U.S., people unvaccinated just dropped their mask use, and then that's what contributed to the, new outbreaks.
But you're not suggesting that people try to figure out, because again, I think the guidance can be very confusing. Like, you need a mask, as you just said, in certain crowded settings. You need a mask in certain places where there's high transmission rates, where there are low vaccination rates. That's a lot for a person to try to manage on a day-to-day basis. So, should we as individuals be trying to make those calculations, or should we just say categorically everybody wear a mask everywhere?
Well, I think it can depend on what the local epidemiology is. So every county, knows its rate of new infections. So I live in California. There are counties in Northern California where, there's very, very little new infection. And it wouldn't necessarily make sense in those counties, if you're going to, restaurants or indoor events, that you would need to wear a mask. But, on the flip side, there are counties now in northern Florida, for example, where there's very high transmission. So I still believe that, our response should be driven by the local data, by the local epidemiology at the county level. And in Los Angeles, which is the largest county in the United States, over 10 million people, that even can be, brought down to a district level or, a regional level within the county.
With respect to this new Delta variant that we're hearing so much about, should you be getting tested if you're vaccinated and you're asymptomatic, but you think you've been exposed to someone that has COVID? Should you go out and get tested?
So right now, the recommendations from the CDC were updated over the past week, that if you are vaccinated and you have a known exposure, so someone contacts you and says, hey, by the way, we were together, we were unmasked, I tested positive, or the health department contacts you and says, hey, you may have been exposed at this restaurant, at this event you were at. Yes, the answer is, even if you're asymptomatic and you're vaccinated, is to get tested, because then you should be masking until you get your test result. And then if you test positive, you need to continue to isolate and, separate yourself from others. And if you test negative, then you can, go back out. And the idea there is to disrupt the ongoing spread of infection, because we also know from recent CDC data that people who are vaccinated tend to have the same amount of virus in their secretions, in their nose, in their throat, as people who are unvaccinated. And early on, we thought that, there might be a difference there, that people who were vaccinated had lower amounts of virus. What we do know, though, is that people who are vaccinated, that amount of virus does go down a lot faster. So people who are unvaccinated with Delta infections may remain infectious for 10 to 14 days, whereas people who are vaccinated, they tend to be infectious a lot shorter, maybe about 5 to 7 days.
There's a debate, Dr. Klausner, about, these asymptomatic cases. And should they even count as breakthrough cases? And I've read a lot of experts saying that we shouldn't even identify these individuals who test positive but maybe have no symptoms. We shouldn't call those breakthrough cases. What do you think about that?
Yeah, there's been a lot of discussion about, what's the definition of a case. So, currently the CDC and state and local health departments call it cases the detection of, any infection, symptomatic or not. People have said, well, we should only call cases if someone has symptoms. Other people have said we should only call cases if they've been hospitalized, right? So, what we do need to have is a, severity of cases, or a stratification of cases, which I think would be helpful. So you would have asymptomatic cases, you would have symptomatic cases, you would have hospitalized cases, you would have, cases that died. And that would give us, a more deeper understanding of the epidemiology if we had that novel framework. I think, initially people were somewhat dismissive of asymptomatic cases because they felt that they were unlikely to spread infection. Remember, very early on in the epidemic in March 2020, the general idea was, well, if you're asymptomatic, that's okay because you're unlikely to spread. Then we learned pretty quickly that people who are asymptomatic can actually spread infection. Then, we've evolved to, okay, if you're vaccinated and asymptomatic, don't worry about if you test positive. Now we know that people who are vaccinated and asymptomatic can spread infection. So, it's not that people were necessarily wrong. It's just that, the science with a new novel infection does evolve over time. So we need to be flexible, and we need to change our game as we move forward.
And so just to be clear, anybody and everybody can spread this virus. Vaccinated people can spread it. Asymptomatic people can spread it. Is that what you're saying?
Yeah, so based on our current understanding of the epidemiology, asymptomatic people can spread infection, vaccinated people can spread infection. So if you have detectable infection, right now we believe it is spreadable.
And given that all of us, vaccinated or not vaccinated, can spread, why aren't we thinking and talking about lockdowns? I heard Dr. Fauci say on one of the morning shows over the weekend that COVID is getting worse, no doubt, and it will get worse, but he says we're not going to see lockdowns.
Well, the early rationale for lockdowns in, March 2020 were to prepare the public health system, because we didn't have testing available. We didn't have a vaccine. There's a lot of uncertainty about the benefits of the mask use. So in the early response to the crisis, lockdowns might have made sense for a few weeks, but now we know a lot more. We have, a lot better tools. We have, the tools of masking, of vaccination. We know that the importance of ventilation and outdoors and air circulation. We also have, better treatments. So I agree, with the current public health leadership that, lockdowns are not necessary necessary. And also lockdowns have, tremendous harm on the community. They result in, job losses. They result in, mental stress. They result in a worsening of poverty, and inequity in certain communities. So lockdowns are extremely drastic intervention that are really only justified in very unique circumstances.
So, given the what we've seen in terms of the rise of the Delta variant, pretty much in most counties throughout the country, some obviously being worse in the South, and places where the vaccination rates are really low, are there places that you advise people not to go? Whether it's a movie theater or a restaurant where you're sitting next to other people who are eating, even though you said we're not going to see, mandated lockdowns from the federal government, what should we be doing as individuals in terms of our own decision making?
Right. Well, I think it would be important to know, where there's epidemic transmission, right? So now we know as of, early August, there's epidemic transmission in parts of Florida, parts of Louisiana, Arkansas, southern Missouri. So, those probably would be, areas where I would tend to avoid being, in indoor settings with a lot of, unmasked individuals. But there's, other parts of the United States in the Northeast right now, and currently, still in California and, parts of Texas where, the case rates are still very low. And, there's also higher rates of vaccination, and it's going to be safer. So people need to make informed decisions, based on, the epidemiology or the frequency of infection, frequency of mask use, their own personal risk. I mean, you have to still remember that, 90% of all deaths in the United States were in those 65 years or older. So young people, while they're getting infected at a higher rate right now, are still at a much lower risk of severe consequences. So young, otherwise healthy people are at a still low risk of being hospitalized or having severe consequences or dying. That doesn't mean it's not going to happen, but it means that the risk is much lower. And young people tend to have a higher risk tolerance. So you have to, check in on your own personal preferences in terms of, risk and risk avoidance and behavior, know about the local epidemiology, have a sense of vaccination in your community. In my community here in Southern California, very high rates of vaccination, but I have friends, who live in Northern Florida where the rates of vaccination are much lower. So, you have to take that information and then act accordingly.
So in LA County, which you are part of because you are at USC, we know that there's a mandate. So are there places in LA County that you would be concerned about? Or are you saying you would still go, but you would go as a vaccinated person wearing a mask?
Yeah, so I would go as a vaccinated person, and I've been to, indoor events over the past few weeks, and in, some of those settings, I try to find a window seat, or, I'm gonna, wear a mask, or I might, avoid if it's particularly crowded, music venue where, no one's wearing masks. So I'm gonna make my, assessment on, the kind of risks and benefits. If it's a particular, fantastic performer that it's a once in a lifetime opportunity, I may, take that risk. Also, as a vaccinated person, even though I was vaccinated at the end of December, so, about 8 months ago now, I know that the vaccine is highly protective against, severe disease and serious consequences. And people who are vaccinated who, do get sick, they tend to have, a couple days of, flu-like symptoms. They may be in bed for a day and a half as the average. And, people have to weigh that, versus the, benefits of going out.
Do you think, given the widespread nature of COVID at this point, that everyone is pretty much doomed to get it at some point?
Well, I mean, I think, we have seen, it is easily spread. It's, widely disseminated in different communities. I think, everyone will probably be exposed. Whether everyone will get it, will depend on their behavior and, their contact with other people. And, vaccination, while again, it's not 100% protective against getting infected, it is 85%, effective at getting infected. So it's still very highly protected. And immunity at the population level, remember, is a combination of vaccination and what we call natural immunity or immunity after infection. And immunity after infection is very protective. So we've recently done studies actually to show that immunity after infection has the same level of protection as vaccination. So when both of those come together, they produce what's called community immunity, which other people have called herd immunity. And it's this immunity that eventually leads to the control of the spread of infection, and the rates of infection go down.
All right, we've got to leave it there, Dr. Klausner. Thank you so much. Lots of information, but boy, this is really confusing. And sometimes you feel like your head is spinning as you're trying to keep up with it. And if you're not a medical professional or a scientist like yourself that, studies this every day and works in this field, it can feel overwhelming and daunting. So thank you for helping clarify so many of these issues that are, causing lots of people to stay up at night, scratching their heads, trying to figure out what to do. I appreciate your time this morning.
All right. Well, thank you. And thank you for your interest in having me on the show. Take care.
All right. My next guest is Efuru Flowers. She's the chair of the Black Women Rally for Action. And joining her is Michael Brown. He's the data and policy director for Black Women Rally for Action. Good morning, Efuru and Michael. You all both are working diligently to get folks, particularly in LA County, vaccinated. And, there are lots of stories out over the last week or so, and even this morning, that say vaccinated people are losing their patience with unvaccinated people. They feel like they did their part. They got vaccinated. They've worn a mask. They, went through the lockdowns, and that unvaccinated people are selfish. We even saw Alabama Governor Kay Ivey come out and say we should start blaming the unvaccinated folks. But I looked at what the governor said. Then I read a column from a LA Times columnist, an African-American woman, who said she understood why Black people in particular were not getting vaccinated, and she didn't think we should be pointing the fingers at them. So both of you are out on the streets. You're talking to lots and lots of people. What's the sense that you're getting about, how people are feeling? Are they more on the Governor Ivey, side, or more on the LA columnist side in terms of how they're feeling about these unvaccinated people?
Well, people are definitely feeling, like I've done my part, you do your part. And then there are others who are really trying to get information out, as your first guest said, to be able to communicate facts about what actually is happening, what's happening in people's families, how people are being ill. And so that's important for us as an organization to keep in mind, that we need to communicate factual information to our community and turn those into stories, because we are a storytelling people too, in terms of Black women, the Black community. And so those stories, we think, help to change minds. We hope help to change minds and advocate on our own behalf in terms of our health.
Michael, in October of last year, and this is, leading up to the vaccines being available, there was a study that said 93% of Blacks in LA County said they were not intending to take the vaccine. Where is that percentage now? That was October, before, the big push towards vaccines. And now, sitting in August of 2021, where are we with respect to Blacks getting vaccinated in LA County?
Well, we're about, 47% who have gotten the vaccination. And that's about right for what we projected for young people, because you raised so many important points. You had several experts talk about what's going on, and young folks told us flat out in the fall of last year, after they had shut down and reopened and shut down, that they're done listening to the government. They say one thing and do another, and then, how can they keep up with really what's going on with these facts? And so we're that 47% that we see right now is about what we had projected. And then this whole blaming piece is blaming folks for 12 months of misinformation that was going out over the airwaves by elected officials and so forth, and here and there, put on the mask, don't put on the mask, and all these things, and now blaming victims of misinformation. I just think it's cruel.
Mm-hmm. And so, Efuru, you and your organization have launched, this massive social media outreach, and we know at the highest level of government, the president, he said he's going to get an army of influencers, TikTok, Instagram, Facebook. He's just wherever people are, he wants influencers to be there. How effective are these social media pushes, particularly for those people that have kind of dug their heels in and have said, you know what, I don't care if it's from LeBron James or Ariana Grande or President Biden, I'm not getting vaccinated. So will these social media efforts reach that person or that group of people?
I really don't think so. I think it's really going to come down to what is my personal experience? What does my pastor say? What is my doctor saying? And that's the only way I think people are going to really change their minds about it. I had a conversation with a father last night about why he decided to finally get vaccinated. And really, it was about his kids. He had a good friend and fraternity brother who just passed from COVID, someone that was really dear to the community's heart. It was a surprise. That was a wake-up call. And then to learn now that kids are able to get the illness, that for him was his breaking point. He did have conversations with his pastor and with his doctor, and still, the overriding decision-making point for him were his kids. And so I think it's going to be a personal sort of decision that people will have to make.
And that's what Sylvester said at the top of the show. His brother-in-law, and I spent a lot of time talking to his sister-in-law, and brother-in-law was 39 years old, hospitalized for 3 weeks in ICU, told by the hospital, family was told by the hospital staff, we don't know if he's going to make it. I mean, they were put on alert that this young man may not survive this. And it was that personal experience that caused one of the sisters, Lori, who became the champion, and she said damn near made her mother, everybody else in her family, we are not going to let our brother die and we not take some action. Now, fortunately, his name is Michael. Michael's doing better. He's recovering and everything turned out okay for him. But as a result of that very personal experience, she became that family champion and walked pretty much everybody else in that family, to the point of getting vaccinated. So I think you're right about those personal stories. But Michael, I read something that's really disturbing to me. And I read that this vaccination, who gets it and who doesn't, is breaking down, not just on racial lines, but on socioeconomic and education. And people who are less educated and make less money are the most likely to not get the vaccine. And they are in the same group of people that are the most likely to get COVID-19, have serious consequences, and die. That really disturbed me.
Absolutely. And we're learning that too within the Black community. We just did a poll on workplace issues and found out that, those who are, part of fraternities and sororities are more likely to get the vaccination, and those who are unemployed are less likely. And so, that disparity is going to be real important to our community. And back to what Efuru mentioned, that when we talk to one another as family members, then we're more likely to have some success in helping folks make the right decision for them in getting the vaccination. I know in my own family, we all had a group discussion about the vaccination before they came available. Now, I'm real clear about before there was a new person in the White House, we're all like, no, we're not getting that. But when things started to change, we started to get accurate information. We had a family discussion about it, and we unanimously talked about we're getting the vaccination. So family members need to talk to one another as well.
Yeah, and for one thing that Sylvester said about his family, he said the debate is going on. He said, honestly, there's some people in his family still don't even believe COVID is real. They still believe it's a hoax. They believe that they can wash their hands, sanitize, surfaces, and that will suffice. What advice do you have for Sylvester or anyone, all of us who may find ourselves in that situation where family members are saying things like that we know just are not accurate based on the good science and the good information that is out there?
Well, just to continue to talk, when we talk about those who are educated, who are more likely to be vaccinated, those are the folks that should talk to the folks who don't believe in being vaccinated. And at the end of the day, people will make their own decision. And that's the unfortunate part. We would really love, right, to be able to affect everybody in a positive way, to advocate for their own health. But it's not always the case. And so I just think it's a continued effort to continue to communicate, look at the data. To me, science is always, new science, things are always coming up, right? And we're always learning new things as we move along. And so it's okay to change a bit and to find out new things to do to help ourselves. And so I just think it's a matter of continuing to communicate and continuing to talk and get the facts when you're making your decision.
I hate that the messages have been so muddled from the CDC, from the White House, from elected officials at the state and federal level. And one thing you just said, Efuru, about science, the president of Meharry was on TV the other day, and he said, science isn't the truth. It's the process of seeking the truth. Yeah. And I just wish that when when the experts were talking to us, they made it very clear from the beginning that this is a fluid process. This is a new virus. We don't know everything we need to know about it. So be patient and understand that our decision-making will change as we learn more. But, that's not the way the message was communicated. So people get locked in to what may have been message A 6 months ago that's no longer applicable today, because now we've learned so much more about the virus, and trying to get people to unhear what they heard or unbelieve what they believed is close to impossible. I will ask you, though, Michael, about mandates. Lots of talk here in LA County, LA City. We hear some big employers. Where do you and your organization stand? Do you think that's going to be our way out of this? It's just come down with the hammer. We've tried the carrot. Now do we need to use the stick and just say, look, we understand your feelings, your thoughts, but we can't afford to allow you to infect other people. Your behavior, your personal behavior has a negative impact on other people.
It's a great question. And the ladies of Black Women Rally for Action Los Angeles County have decided to take a neutral stance on that. They're more of an education and getting the information out so folks can make the best decisions. But what we don't want to happen is that Black folks are pinpointed out and singled out for this, because as we know, we're most likely to be unemployed as it is. And that if this is going to have a detrimental effect on Black folks, we're totally against it. We're all for safety. I would love to work in a workplace where everybody was safe and that, I could feel comfortable. But we do know, like in AIDS, we promoted condom use and all these other things to support people. And some people will not do it. And so we want to make sure that our people are not left behind, like in the AIDS epidemic, like in the drug epidemic, not in the prison epidemic, where folks just finally say, we're done with them and fend for yourselves. And that's what we see beginning to happen when folks are starting to blame the victims here.
And just last question for you, Efuru. What's on the horizon for your organization with a high increase in infection rate that's happening in LA County and the slowing down of vaccines? I think I read a report that said there's a slight uptick across the state of California, but for the most part, vaccines have fallen off significantly. What's next for your group in terms of how you try to move the needle on this? We're
going to continue to find the facts and get them out to our community in ways that we actually understand. And for us, that's stories. That's partnering with organizations who are wanting to do the same work. And so for us, it's all about positive outcomes for our community. And we'll continue to do polls and find out what we're thinking and communicate that out to even policymakers, but also to our community, continuing to give them the facts and tell the right stories.
So important, obviously, the facts. Thank you so much, Efuru. Thank you so much, Michael, for the great work that you're doing. Keep talking to folks. And like you said, putting that information out there, because we know knowledge is incredible and knowledge is power. And we need a whole lot of knowledge and a whole lot of power to defeat this virus. So again, thanks to both of you for sitting down with me this morning.
Thank you.
Wow, I want to say thanks to all of my guests. These shows, every time I do one, I keep thinking, well, we won't be doing a COVID show for a long time because, we got COVID under control. And then, the Delta variant and mask mandates and drop off in vaccine rates, things just keep happening. And we heard from Dr. Offit, we're going to move into the winter. So, we're going to be talking about COVID a whole lot more, looks like, come this winter, because there's so much that's happening. And my producer just reminded me, La Palooza, I think it is, the big concert in Chicago that just happened. These big concerts are going to keep happening. People are going to keep gathering. So many of them unvaccinated and so many of them without masks. And as long as that happens, we're going to keep seeing the spread. So I don't know. We got to find a way, and I'm not going to get pessimistic. I'm going to remain optimistic that working together, we will find a way out of this. And some things are happening that I think are going to have an impact. And my words to live by, here are some words to live by for you. And it's vax that thing up. Yes, vax that thing up. 90s rapper Juvenile has teamed up with Manny Fresh and rapper Mia X to encourage people to get the COVID-19 vaccine by recreating Juvenile's hit song of the 90s, that classic song, which was Back That Ass Up, for those of you that remember. And he's, giving it this interesting little twist to encourage folks to get vaccinated. And it's a part of a PR campaign for a singles dating app called BLK. And they're trying to reach, thousands and thousands of young people that visit this dating app. The site also released a Vaxified badge that allows its users to promote their vaccinated status. So I say bravo to Juvenile and bravo to BLK for using their platform to raise vaccine awareness, for trying to reach young people where they are, for coming up with creative ways to do that. And, talking heads and experts are fine, and they reach a certain segment of the population. But those young people that are not watching cable news, that are not listening to elected officials who, said enough with the government, may be inclined to listen to their favorite rapper. So we're going to end the show with Vax That Thing Up by Juvenile. Be safe out there, wear your mask, and don't forget, we are all in this together.
Chat, find a mate chat, open up BLK ass, okay yeah, profile picture looking tight chat, nice chat, got your bio reading right chat, precise chat, but before you find a date chat, you gotta wait chat, gotta go vaccinate chat, get it straight chat, girl you look good, want you vax that thing up, you's a handsome young brother, want you vax that thing up, dating real life, you need to vax that thing up, feeling freaky all night, you need to vax that thing up, girl you look good, want you vax that thing up, you's a handsome young brother, want you vax that thing up, dating real life, you need to vax that thing up. Feeling freaky all night, you need to vax that thing up.
I know you can't stand it, no holding hands, chick. But when we get the shot, we gon' be romancing. Girl, you could be the queen after quarantine. We could meet up at the spot and we could do the thing. Internet date chat, I'm your mate chat. Download the app, shawty, you ain't gotta wait chat. I love it when you hold me, eggplant emoji. You could